Hey, Dr. Nunez Smith.
How you doing, Lonnie?
I got
Hello.
my stretching. I'm like, come on, you White House people. We should.
I I was enjoying it. I have to say, I really wanted you to keep going.
Well, thank you for joining us. And if you could give us your thoughts and opening of what's happening with the pandemic, give us the latest information.
Yeah, it's great to be here with everybody tonight. And I'll take a few minutes. I really appreciate the opportunity just to sort of ground set for us where we are and provide some context. Really appreciate you, Lonnie, having this conversation, leading us tonight. Your voice is so critically important and trusted. So thank you for that. And, absolutely, to the women of the Divine Nine, I just have to take a moment up top and say, the legacy there is tremendous, right? When we think about scholarship, service, just a bedrock across our communities, generations of Black excellence paved. So just a moment of gratitude and thank you for everything you're doing. And I want to take a moment and talk about today, right, which is really an exciting day, really important day for us at the White House and the federal administration. We've entered a new phase in the vaccination program. And so as many people have probably heard, starting today, everyone in the country 16 years old and older is eligible for the COVID-19 vaccination. So no more trying to figure out when it's your turn. It's everyone's turn now to sign up. We know it hasn't always been easy for everyone. When we arrived in January, the new administration, it was palpable. Americans in the country were frustrated. That was understandable with the pace of vaccination. There weren't enough vaccines, not enough places to get vaccinated. We didn't have enough vaccinators, people to give the vaccine. And of course, it was really confusing about who could get vaccinated, where, when. And so we got to work. Everyone in the administration worked around the clock, the whole of government. We talk about FEMA personnel. They're out there getting shots in arms across the country. Our brothers and sisters in the armed forces overseeing the shipment, delivery of vaccines, the scientists, the clinicians at the FDA, the CDC, the NIH, who ensured the safety of the vaccines and that they work. So now we have enough vaccine supply for all adults. That's thousands of vaccinators as well, ready to get you vaccinated. Over 60,000 convenient places for you to go and get your shot. As of today, our statistic is that at least 90%, a little bit more, of Americans have a vaccination site within 5 miles of where you live. Already, more than 130 million people have gotten at least one shot. That's more than half of all adults. So that's a lot to celebrate, but we know some communities are facing challenges. Just today, we announced nearly $150 million from the American Rescue Plan that's going to go to community-based healthcare providers to get them more engaged in the COVID-19 response. So much to do, and we know we got to celebrate where we are. We didn't get to this major milestone alone. We have to acknowledge the doctors, the researchers, and importantly, acknowledge that it's decades they've been working on the technology that's led to the vaccine development, the vaccines that are effective and have been safely administered to millions in the US. We have thousands of healthcare workers out there working, getting shots in arms, community-based organizations, grassroots organizations, leaders, local pharmacies and pharmacists, just making sure there's access in their communities. We've got warehouse workers, truck drivers to thank for getting vaccine doses to every single corner of our beautiful country. We've got to thank those who participated in the clinical trials. And we definitely have to thank the people who are in our audience today, who are trusted messengers who have been out there educating, providing accurate information to family, friends, neighbors about getting vaccinated. So thank you for everything that you've been doing.